Hello, I'm Misty Barron, a flight nurse with the Trinity Mother Frances Hospital and Clinic's Flight for Life program. Welcome to our ground safety course. In the next few minutes, we're going to discuss how you can access and work with Flight for Life as your partner in patient care and transport.
Flight for Life began in December 1985. Mother Frances Hospital saw the need for rapid transport of critically ill and injured patients, from isolated rural medical facilities and EMS agencies to tertiary care centers such as Mother Frances Hospital. Today, the Flight for Life Air Medical Program continues a strong commitment to the ill and injured that began when Mother Frances Hospital Tyler opened its doors a day early in 1937 to service the communities injured from the New London School explosion. The New London School explosion is East Texas's largest single trauma event to date. Since opening its doors, Mother Frances Hospital has remained committed to superior trauma care across the region. Trinity Mother Frances Hospitals and Clinics serves the entire East Texas region, with more than 1 million patient visits annually. Trinity Mother Frances Hospitals and Clinics is a regional referral center for cardiac services, neurological services, obstetrical and gynecological services, pediatric services, hyperbaric oxygen services, and neonatal and trauma services. The Emergency Care Center at Mother Frances Hospital Tyler sees over 67,000 patients per year in its 50 beds. The hospital also maintains a Level 3A neonatal intensive care unit, with 18 beds for newborns 28 weeks or greater. Additionally, the hospital includes 24 medical trauma ICU beds, 12 neurological ICU beds, and 14 post-interventional cardiac service beds. Mother Frances Hospital Tyler maintains accreditation as a Level 2 trauma center, a chest pain center, and as a tertiary stroke center. The Flight for Life fleet will respond to patient requests within 150 nautical miles of Tyler, with 80 nautical miles of Tyler our most frequently visited area. In the event appropriate patient care is not available in Tyler, Flight for Life routinely transports patients to facilities in Longview, the Dallas-Fort Worth area, Texarkana, Shreveport, Houston, and other appropriate facilities. When requesting air medical transport for your patient, the primary focus should be on patient safety. Flight for Life has operated accident-free for over 2 decades. Trinity Mother Frances has invested over $1 million to assure each of our aircraft maintain industry-leading technology and maintenance, including night vision goggles, terrain avoidance technology, traffic collision avoidance systems, onboard color weather radar, and GPS navigation. Both aircraft are twin-engine airframes and are designed to allow full-body access to 2 patients.
Hello, my name is Anthony Baca. I'm the Chief Flight Nurse and Clinical Director for Flight for Life. Our ground safety course is divided into 3 areas: activating the system, preparing the landing zone, and ground operations.
Flight for Life can be activated 2 ways. If considering the need to transport a patient from the scene of an accident or illness to any hospital, or if you need to transfer a patient from your hospital to any hospital that is not a Trinity Mother Frances Hospital, you can call Flight for Life Dispatch at 1-800-441-8677. For a hospital-to-hospital patient transfer to any Mother Frances Hospital, you can obtain physician-to-physician contact or consultation, hospital administrative acceptance, and transport by simply calling the Trinity Mother Frances Transfer Center at 1-866-634-7363. A common question is, which patients are appropriate to utilize air medical transport? Examples of appropriate indications for flight include acute coronary syndromes, acute neurological emergencies, and major trauma emergencies.
Code STEMI really starts with an acute heart attack or myocardial infarction. Technically, this means that an artery, one of the 3 arteries on the surface of the heart, has closed with a blood clot. That is then depriving the heart muscle of blood flow or oxygenation and causes damage. The Code STEMI system is really an integration of 3 different departments. The emergency medical system that activates the Code STEMI in the field, the emergency room department that rapidly evaluates the patient and activates all of the relevant personnel, and the cardiac catheterization team that literally takes the patients from the emergency room department to the cath lab and opens up that artery rapidly. The bottom line is that if you're a patient in the East Texas region and you're having an acute heart attack, you know now that time is muscle. The quicker that that artery is open and you get blood back to your heart muscle, the better you're going to do. You therefore want a system such as Trinity Mother Frances, which has an integrated, proven, and quality-driven program to get that artery as open as quickly as possible. And that is our Code STEMI system. It is nationally recognized, and its times are the best in the nation. We have clinical research that we have done to stand behind it, and we are continuing to improve the quality of the system for the patients of East Texas.
Currently, the way we treat stroke is by initiating a number of interventions, and some of them are actually time critical. And because the intervention requires a number of steps to occur, the earlier we can get these steps started, the sooner we can give the final treatment. And because the EMS system sees the patients early after their injury or after their stroke, they're in the position to treat patients or start the process of treatment earlier. The sooner we could get the patients in to see us, the better off the patients are going to be. And by EMS and Flight for Life understanding this issue and understanding how we treat patients, they can become a tool by which we get patients in earlier. The other thing is by them becoming part of our system, the protocols that we are currently starting to institute in the emergency room can be instituted earlier. If it's a 10-minute flight or a 15-minute flight, we don't have to wait those 15 minutes to start instituting the therapies. That can be instituted in the field.
We integrate very closely with our colleagues in EMS, both ground and flight. That includes communications. That includes our colleagues in the emergency department, diagnostic, et cetera, and so forth. So if you have a comprehensive system where from the moment that you come into the system and you interface with the paramedic in the field, that information is being transmitted live to the center. And there's an old saying, forewarned is forearmed. The better prepared we are to take care of you before you come to the hospital, the odds are that your outcomes are going to be better. And that's been proven in the past. All the 4 trauma surgeons are at minimum double, if not triple boarded surgeons. We're all critical care surgeons. We also have a fairly broad experience in not just adult, but geriatric and pediatric trauma care. We have additional experience in burns, and we do vascular, cardiothoracic, major abdominal. Some of our areas of research have been major abdominal disasters, major liver, aortic injuries, and stuff like that. So that's a distinction between a trauma surgeon per se versus general surgeons. General surgeons have their areas where they're very expert in, and they do an excellent job in that area. Trauma happens to be ours.
Hello, I'm Mark Anderson, and I'm the Medical Director for Flight for Life. In addition to acute coronary syndromes, neurologic, and trauma emergencies, other indications for flight include mass casualty situations, obstetric emergencies, for example, preterm labor or placental abruption, acute vascular emergencies requiring time-sensitive care, when time-sensitive specialized services are required that the local receiving hospitals are not equipped to provide, for example, critical care services, obstetrics, neonatology, or dialysis, patients that require care available on the aircraft that is not available on a ground ambulance, and patients with electrolyte disturbances or toxic exposures that require immediate intervention.
Hello, I'm John Skelton, a flight paramedic with Flight for Life. In addition to the patients we care for in East Texas, Flight for Life also transports patients to specialty centers like children's hospitals and burn centers.
Examples of these types of patients include severe pediatric trauma, limb reimplantation, patients with greater than 15% total burn surface and 2nd or 3rd degree burns, a patient with 2nd or 3rd degree burns involving their hands, feet, genitalia, or face, inhalation burns, significant chemical burns, and significant electrical burns. If you feel the patient requires air medical transport to improve their clinical outcome, we will respond to all requests from fire, EMS, hospital, and law enforcement professionals, whether or not the patient meets one of the criteria we have discussed. Flight for Life may be called to transport a patient between healthcare facilities for any of the criteria just listed. Additionally, the flight crew may be called to transport a patient between facilities for any of the following conditions: transports of patients that require critical care capabilities en route between hospitals. Examples include mechanical ventilation or BiPAP, blood products, vasopressors, and medications above the scope of practice of local EMS providers. The flight crew may also be called for inter-facility transports of patients that require short out-of-hospital times.
Hello, I am Macy, a Flight for Life Communications Officer. When calling Flight for Life, we need some information from you.
Our Communications Center will ask you for your name and title, the name of your agency and phone number, the general location of the incident with GPS coordinates if available, the nature of the request such as acute coronary syndrome or motor vehicle collision, the patient's sex and age, if known, the patient's weight, if known, the destination if possible, the ground contact, and a frequency if Texas Fire 3 is not available, and if any other aircraft have been requested for this patient. If calling for a hospital-to-hospital transfer, dispatch will also need the transferring and accepting physician names, where the patient is in your facility, such as the ICU, ER, etc., the patient's diagnosis, the accepting hospital and unit destination, any medications the patient will receive en route, and if the patient is intubated or on a non-invasive mode of ventilation like CPAP or BiPAP.
Hello, I'm Craig Mattingly, a flight paramedic with Flight for Life. When requesting any aircraft, it is important to remember the first priority must be patient safety.
Please tell the Flight for Life communicator if another helicopter program has already turned down your request for a helicopter because of weather. Flying a patient in weather that is poor is dangerous for the patient and the crew. There are occasions where our flight team may be able to accept a flight that another flight program has turned down because of geography, weather pattern changes, or the capabilities of our aircraft. But we do not want to put the patient at risk, so it is imperative we are provided all the information available so that we can make the best decision for you, your team, your patient, and our program.
Hello, my name is Amy Parsons, and I'm a flight paramedic with Flight for Life. Often you receive information about critical patients before you actually make contact with the patient.
As a paramedic responding to a scene, you may receive information from your communications center that a patient is critically ill or injured. Alternatively, if you are working in the emergency department, as a member of the hospital staff, you may receive pre-arrival information from EMS or law enforcement sources that you will be receiving a critical patient. Whether you are a member of a hospital or public safety organization, we strongly encourage you to activate Flight for Life as soon as you receive information about a critical patient. The sooner you notify us, the sooner we can be there to assist your team to provide patient care, to obtain facility acceptance, or help with other clinical and logistical concerns. In the event you are uncomfortable launching the aircraft based on the information you have received, you are welcome to put the aircraft on standby. Based on the information obtained from our communications center and your request, the flight team will respond to the aircraft, prepare it for flight, and complete mission planning and preparation. Based on the distance to be covered, the flight crew may even elect to begin flying towards your destination. Once you obtain more information, and if the aircraft is still needed, the standby process will decrease the amount of time necessary for Flight for Life to get to you and your patient. In the event you decide the aircraft is unnecessary, the flight will be canceled. We do not charge anyone for standbys when we are canceled, whether we have lifted off the helipad or not. When you arrive on scene, we ask that you assess and launch the aircraft in the first 60 seconds if possible. Please consider the perspective of the helicopter when describing the landing zone. County road numbers are of less value than location, and distance from towers, lakes, large buildings, and illuminated signs.
Hello, I'm Trey Moses, a flight nurse with Flight for Life. When preparing the landing zone, we need a clear area 100 feet by 100 feet.
The pilot will need to be advised of any fences, stumps, poles, antennas, light poles, cell phone towers, especially if they are unlighted, trees, vegetation, loose dust, gravel, plywood, or sheet metal that is near the landing zone area. Special attention should be paid to the presence of power lines. If the aircraft were to come in contact with power lines, the results could be devastating. Black power lines against a black roadway can be invisible from the air, so it is crucial that the LZ commander identify power lines, mark them, and make the flight crew aware of their location prior to landing. One way to help identify power lines is to park an emergency vehicle directly underneath each one. As the aircraft approaches the landing zone, the pilot will circle the landing zone looking for the obstructions and hazards you have reported. Please do not use flares to mark the landing zone. A better way is to place vehicles under obstructions and under power lines. If the landing zone area is dusty, please wet the area down before the helicopter arrives. The landing zone should be inspected for any foreign object debris prior to the arrival of Flight for Life. When giving directions to the pilot, refer to the left or right of the aircraft or use the clock method, with 12 o'clock being the nose of the aircraft and 6 o'clock is the tail. 3 and 9 o'clock are the right and the left of the aircraft. In order for the aircraft to land at the landing zone, we should have radio contact with the incident commander or the person in charge of the landing zone. The flight crew will contact you and Texas Fire Number 3 during operations. If you do not have access to Texas Fire Number 3, we will attempt to contact you on the frequency of your preference. The landing zone is secure when bystanders have been cleared by law enforcement and the fire department is ready. The headlights are on, marking the landing zone, but not pointing into the pilot's eyes. The landing zone officer is standing in the center of the landing zone, hands overhead with headlights pointed at them. Remember, we come to the patient. The patient does not come to us. Leave the patient in a protected area like the ambulance while the aircraft lands and the crew approaches the patient. At any time the LZ commander feels the pilot should abort the landing, they will wave their arms back and forth above their head to signal the pilot not to land. As the aircraft is on final approach, the landing zone commander should leave the landing zone so the aircraft can land. Remember, the final responsibility of acceptance of the landing zone site belongs to the pilots. The pilot may choose a more suitable landing zone.
Lindale Fire Department, this is Flight for Life on Texas Fire 3.
Flight for Life, this is Lindale Brush 1 on Texas Fire 3.
Lindale Brush 1, we are approximately 5 minutes out from your landing zone looking for information.
Received. We have a secure landing zone available for you in a large field. To the north, you're going to have an unmarked cell phone tower with a line of trees. To the east, you're going to have a row of hay bales. To the south, you're going to have a crane about 200 feet tall. And to the west, you're going to have a roadway with power lines near the roadway. It'll be marked by our engine 1.
Left received. Thank you, sir.
Hello, I'm Robert Bell. I'm a flight nurse with Flight for Life. Many incidents require the utilization of multiple aircraft to respond to the scene.
In order to avoid confusion and possible injury between providers, the need for good communications is paramount. All aircraft must be notified of any additional responding air medical programs. A common air-to-air and air-to-ground frequency must be in place. The on-scene landing zone commander should relay the location of all LZ sites to each responding aircraft. As the on-scene landing zone commander, it is critical to control the flow of aircraft in and out of the scene by directing when, how, and where you would like each aircraft to land. Should any aircraft discontinue their response to the scene due to weather, all additional responding aircraft must be notified immediately. Multiple aircraft responses are fraught with danger, but risk can be mitigated with strong communication and direction from the on-scene commander.
Hello, I'm Paul Wheeler, a flight nurse with Flight for Life. The third and last area of the ground safety course is ground operations.
Never approach the aircraft without directly and specifically being requested by the flight crew. Remember, the air medical team will go to the patient. Please be sure the patient is in a protected area like an ambulance, while the aircraft lands and the crew approaches the patient. Please do not bring the patient to the aircraft before the air medical crew has had a chance to assess him or her in a safe area away from the aircraft. The medical crew will place a tail rotor guard outside the main rotor blades inside of the pilot. This person should not leave until directed by the Flight for Life crew. He or she is responsible to keep everyone clear of the tail rotor while the aircraft is on the ground. During loading and unloading, please allow the Flight for Life crew to open and shut all doors. Only the flight crew must operate the stretcher release mechanism. Orientation to the tail rotor is among the chief concerns when working in and around a helicopter. The speed of the tail rotor makes it almost invisible in clear daylight. Therefore, never go behind the horizontal stabilizers. The easily demonstrated height of the tail rotor on the BK-117 and EC-145 provides for an industry-leading level of safety.
Hello, my name is Scott McQueen, and I'm the lead pilot for Flight for Life. The Flight for Life fleet consists of 2 aircraft.
Our first aircraft is the new EC-145, manufactured by American Eurocopter. Our second aircraft is the BK-117, which has been the industry workhorse for several decades. A spacious cabin, impeccable safety record, and full access to 2 patients are among the industry-leading features of the BK-117 and the EC-145. The EC-145 features a 21st century glass cockpit that consists of the following instrumentation: primary flight display, navigation display, caution and advisory display, vehicle engine multifunction display, and a Garmin 530 display. It is also equipped with the Garmin GNX 200 multifunctional moving map, which displays traffic advisory, terrain awareness, weather radar, multiple air navigational maps, and approach plates. The onboard weather radar is backed up with the XM satellite weather. A further increase in aircraft stability and safety is gained by the usage of a 3-axis autopilot. The EC-145's improved rotor blades are combined with a hingeless rotor system with a monolithic titanium hub and are powered by 2 Turbomeca Ariel 1E2 turboshaft engines. The EC-145 and the BK-117 both provide an ideal safety environment, with the patient fully secluded from the pilot and flight controls. Not all air medical aircraft can provide this level of safety. Additionally, both aircraft provide full body access to both patients. All aircraft are limited by weight. Fuel, staff on the aircraft, equipment, and patient's weight are major factors when considering the ability of an aircraft to safely complete a mission. Both twin-engine aircraft owned by Flight for Life are among the most powerful used in the air medical industry today. In the event of an aircraft emergency, the windows on the side doors of the EC-145 can be removed by applying firm pressure at these markers. The doors may be removed on the BK-117 from inside by pulling this lever and from outside by pulling this cable. Our capabilities at Flight for Life are not limited to the strong capabilities of our aircraft. We assure quality and safety by selecting the best people we can find to staff our program. All of our pilots have had to have a minimum 2,000 hours of flight time before they could even apply to our program. Our pilots undergo constant training in aircraft operations, emergency procedures, instrument flight rules, and night vision goggle operations so that they are constantly prepared to provide the safest transport possible for your patient. Our medical crew is composed of a flight nurse and a flight paramedic. Flight nurses must have a minimum of 5 years' experience in the emergency room or in the critical care unit of a major medical center prior to application. Additionally, each flight nurse must obtain licensure as a paramedic. Our flight paramedics must have a minimum of 5 years' experience in a progressive EMS system prior to employment as a Flight for Life team member. All medical crew members are certified in ACLS, PALS, NRP, and an advanced trauma program such as ATLS. Upon hire, each crew member must complete a rigorous Flight for Life residency program, which includes hundreds of hours of classroom, dynamic human simulator training, and human cadaver training. Additionally, all crew members are required to obtain board certification in critical care and transport medicine. Each crew member is credentialed for advanced practice, and crew members routinely perform advanced procedures such as 12-lead EKG interpretation, medication-assisted intubation and RSI, surgical airway placement, chest tube, central line, and arterial line placement, fetal monitoring, ventilator management, point-of-care laboratory testing and result management, digital blocks, hemodynamic monitoring, blood product administration, and induction of post-cardiac arrest therapeutic hypothermia. Our aircrafts carry a full complement of medications and equipment necessary to care for the sickest patients. Our aircrafts are equipped with LifePak 12 or 15 monitors with 12-lead EKG, capnography, pulse oximetry, and invasive pressure monitoring capabilities, GlideScope fiber optic airway imaging technology, portable ultrasound, a fetal monitor, point-of-care laboratory testing equipment, LTV 1200 ventilators with invasive and non-invasive ventilation capabilities, and ice saline for hypothermia induction. While we invest a lot in training and equipment, we feel this commitment is crucial to support our mission to bring ICU care outside the walls of Mother Frances Hospital to the patient.
The safe and successful completion of a patient flight requires the coordination of many equally important professional organizations and groups. We're pleased and grateful that you would choose Trinity Mother Frances Hospital and Clinic's Flight for Life as one of your partners in the quest to provide the best care to your patients, friends, and family members. If you would like more information on Flight for Life, you can find additional program information on our website at www.flightforlife.info. Additionally, you can follow Flight for Life on Facebook or on Twitter.